It's the Raw Skeptic Report with Heidi Robinson.
Adverse effects to any vaccination can and do occur. However, these are usually very minor or extremely rare. 1 to 10% of people suffer from some fever, malaise and myalgia, which may mimic influenza infection, but this is mild and short-lived. In children less than 5 years of age, these side effects may be more pronounced. A sore arm with redness and swelling can occur at the injection site. However, most patients report that these events are transient and resolve fully within a few days. In 2010, an excess of fever and febrile convulsions following influenza vaccination was reported in children aged less than 5 years, particularly children aged less than 3 years. This was associated only with one manufacturer's vaccine, Fluvax and Fluvax Junior by CSL Limited, and this vaccine is no longer registered for use in children aged less than 5 years and is not recommended for administration in children aged less than 10 years. Immediate adverse events, such as hives, are a rare consequence of influenza vaccination and probably represent an allergic response to the egg protein. However, even a history of anaphylaxis with eggs is not an absolute contraindication to the vaccination, but should be done in consultation with a medical provider. A small increased risk of Guillain-Barré syndrome, which is transient paralysis, was associated historically with one influenza vaccine in the United States in 1976. But since then, close surveillance has shown that Guillain-Barré syndrome occurs at a very low rate of up to 1 in 1 million doses of influenza vaccine and is more common after the influenza disease itself. One of the most common myths you hear from people who have received the influenza vaccine in the past is that they will never get it again because it actually caused them to get influenza. Now, this is actually impossible, and I'm quoting straight from a meme, again, that Dr. Rachel Heap has written and which is available on our website. And it reads as follows. After a flu vaccine, you may feel a little unwell for a short time with symptoms such as a temporary mild fever and fatigue. This is not influenza. Influenza is an illness that lasts for weeks and can lead to persistent high fevers, prolonged muscle pain, headache, respiratory failure, cardiac failure, and death. The reasons why you might have flu-like symptoms after the influenza vaccine. 1. You mount an excellent immune response to the vaccine, which can make you feel mildly unwell for a short time. 2. You caught influenza before the vaccine had a chance to work. It takes 2 weeks for it to reach maximum effectiveness. 3. You caught a strain of influenza not covered by the vaccine. The vaccine covers the strains expected to be the most common and most dangerous for the season, but there are others. And 4, you might just have a nasty cold.
You've been listening to The Skeptic Zone. Visit our website at www.skepticzone.tv for comments, contacts, and extra video reports.